My name's Steve Ross. I'm one of the physical therapists here at Baptist Orthopedic Hospital. I've been a physical therapist for 36 years, mostly orthopedics that entire time, mostly sports medicine and orthopedics. We're going to talk about some things today relative to physical therapy here in the hospital and when you go home. One of the best ways to help control pain and swelling in the hospital is by the use of cryotherapy or cold therapy. Here in the hospital, we use a cryotherapy system, which consists of a bucket that has ice and water in it, and it circulates via a pump into this special pad. The pad has a fuzzy side and a shiny side. This is the side that's going to be colder. This is the side that's away from the skin. Now, we use this on hips or knees right out of the surgery. When you come to your room, you'll have this applied. We can leave this system on pretty much all the time because the surface of this pad never gets below 45 degrees. So in that way, we can help prevent pain and swelling right from the start. If it's a hip patient, we usually remove these pads and it's applied up to the hip. Now you can help hold it on with towels or maybe even a comforter, something that helps provide a little pressure to that. Now, when you go home, you probably aren't going to have this system. So at home, you're going to use commercially available cold packs. One of the things you don't want to use are these things. They're much too hard to try to apply to a knee or hip. You want something that will conform to those irregular surfaces, so don't use these. The easiest thing to use is a bag of peas or corn, like this. Just leave them in the bag they come in. Take a dish towel, one surface of the dish towel, wrap the peas or corn in the dish towel, and apply to your knee or hip. Now, if you're applying this at home, make sure you pull the pants up so you can get just one layer of cloth between the peas or corn and your knee, or same thing applies to your hip. Now, the rule with something coming out of the freezer is 20 minutes on, 20 minutes off. Remember, this is a lot colder than this system, so you can't leave this on all the time. It's 20 minutes on, 20 minutes off. But you can apply that as many times during the day as you'd like. Now, sometimes you're going to have pain in back of the knee and not in the top of the knee. That's okay. Put your ice back there. Same thing applies to your hip. You may not necessarily have pain over the incision. It might be down on the thigh. It's okay to put ice there as well. So use ice as a pain control device at home. We'll begin your exercises immediately after your knee or hip surgery. Please do the exercises as prescribed by your therapist as they change from day to day. The first exercise we're going to start with is ankle pumps. It's very simple, just pumping the ankle up and down. Now, it's not just the toes, it's the entire ankle up and down. This is going to help control the swelling that you're going to have in your lower leg and help to prevent blood clots. All right? The next exercise is called a quad set. The quad is the muscle that's on top of your thigh. We're going to tighten that muscle on top of the thigh. You may see that your heel comes off the bed. That's an indication that you're doing a very good quad set. If you're having trouble initiating that, sometimes what we'll do is we'll take a small towel roll or washcloth roll and put it under the back of your knee. Now, what I want you to think about is pushing the back of your knee down into that towel. You can see how the thigh tightens, the heel comes off again, and she's feeling pressure on the back of the knee here. All right? If you're not feeling that pressure, then you're not pushing down and you're not tightening the thigh muscle. Okay? A lot of the exercises that we do after hip or knee surgery are to strengthen this thigh muscle because that's the muscle that straightens your knee when you step on it. We don't want it to give way on you. So tightening and strengthening this thigh muscle is very important. The next thing we do is called ab and adduction. What you're doing with that is you're just lifting the leg slightly off the bed enough to clear the mattress. Out to the side and back in and down. So it's tighten, lift, out about 45 degrees, back in and down. Always remember to relax between each repetition. So up, out, in, down. Very good. Another exercise we do is called the glute set with both legs straight. You're going to simply tighten your buttock muscles together. Hold that for a count of 5 and relax. Tighten, hold that for a count of 5 and relax. This is particularly important for hip patients because a lot of the muscles that go around your hip are in the back in the glute section, so we want to make sure we get those good and strong. The next exercise we do is the heel slide. If this is your operated leg, you're going to slide the heel, bending the knee. There we go. And then back down. So your knee is going to be very sore, so it's very important that you start slow and small. Don't try to go up the entire way the first time. So as you continue to do them, you'll notice that your knee starts to loosen up and you're able to slide your heel up further. So keep going up and down until you feel your knees start to loosen up. All right. Eventually, what you're shooting for is that the knee flexes all the way up and your foot is flat on the bed. So it's about 45 degrees. So this is a good exercise for hip patients as well as knee patients. So the hip's at 40, the knee is approaching 90 degrees. So good exercise for increasing range of motion. All right. The next exercise is done with a rolled up towel about this size. And we're going to be putting that under the knee, letting the knee drape over the towel. Whereas again, we're tightening this thigh muscle, pushing the back of your knee down into that towel. Your foot comes up. You're going to hold that, count of 5, and then let it back down. Again, straighten, come up, and back down. Now what we don't want to see is as you come up, you lift your leg off of the roll. That's not the right muscle we're working. That's more of a hip muscle. We're working this muscle. So you want to push the back of your knee down into that towel and straighten the knee and tighten this muscle. So this is where you're going to feel the tension. Okay? Short arc quad. The next exercise is called the straight leg raise. We're going to bend your opposite leg. This is to help preserve your back. We want to make sure that doesn't get injured. You're going to, again, tighten the thigh muscle, straightening the knee. You're going to lift about to the height of the other leg and then back down. Now, the hard part about this exercise is that you maintain the leg in extension the entire way up and the entire way down. So you're going to tighten, lift, and then back down. So here's what we don't want to see. As you lift, we don't want to see that leg drop down there like that. You want to try to keep that leg as straight as you can all the way up, and don't let it sag on the way down either. So keep it straight on the way down as well. That's the hardest part. The next group of exercises are done in the chair. Here in the hospital, generally it occurs in the recliner. So this is going to be your operated side. So what we want to do is sit at the edge of the chair. There you go. And then you're going to slide your heel forward and back. Go as far as you can. Now as you go, good, and forward. The first 3 or 4 reps are going to be pretty tight. But as you continue, you're going to see that you can pull your foot back further and further as it gets warmed up. All right. Good. The other part of this exercise is extension. So slide back in your chair. Let your foot kind of dangle a little bit. Relax your knee. And you're going to straighten the knee. Again, trying to get this muscle really tight, getting the knee as straight as possible, and then letting it back down. And up. All right, very good. Now, sometimes we have you doing these exercises quite frequently during the day. So there's two ways you can do while you're resting between sets. You can use your extension block if you have one of these. You can rest your foot up on the extension block. Then when it's time to do your exercises again, you just move the block out of the way and do your bending and your straightening. Good. Back up. Having your foot in the block when you're sitting doesn't count for your stretch. That only applies when you're laying down flat. Again, when it's time to do your exercises, lift, bend, and straighten. Now, the other thing you can do, if you're in a recliner, is simply raise the feet of the recliner. Now, an important thing to know when you're in the recliner is you don't want anything under your knee so that your knee is flexed while you're in the recliner. We want the knee all the way straight while you're resting. Don't turn your knee out and bend like that. Have your toes pointed straight up, making sure your knee is straight. Now, when it's time to do your exercises again, you're going to reach back, pull the handle, slowly lower your feet, and then do your flexion and extension from that position. Now, if you're coming back and you notice your foot is hitting the chair, you need to scoot out a little bit more so you have a little more clearance there. So up and back as far as you can go. And up and relax. Now, we'd like to increase your reps or number of repetitions of each exercise up to 20 reps 3 times a day on each exercise. So with the exercises in the chair as well as the ones in the bed, you're going to want to do 3 sets of 10 at least 3 times a day. Now, you're going to have to build up to that. Here in the hospital, we'll try to start off with maybe a couple sets of 10. As you get better and better and your pain decreases, you can go to 3 sets of 10. Let's talk about proper use of the walker and what gait you want to use when you're walking with the walker. Immediately after your surgery, if this is the surgery of your leg, we use what is called step 2 gait. So what Trish is going to do is move the walker out, step with the surgery leg, making sure the heel touches first, and then step 2 with the other leg. So walker, right leg, left leg. Walker, right leg, left leg. Now, later on, as you get better, we're going to use what is called a step-through gait. Still, heel touches first. We're going to roll off the toe and step through with the non-operated leg. So walker, operated leg, heel touch, step through with the other leg. Now roll off those toes on the right side. Good. Walker, heel touch, step through with the non-operated leg, roll off the toes on the surgery leg. We're not concerned about speed, we're concerned about quality here. So making sure your heel touches first. As you see, the knee straightens when you do that. And then when you roll off your toes, the knee bends. This is a normal gait pattern. Very good. The goals of the exercises are to increase your strength and range of motion of your knee or your hip. So, being able to get to at least 90 degrees is very important. You want to try to get there as soon as possible if it's your knee exercises. So bending the knee so that this angle is 90 is going to be critical over the next week or so. So be aggressive about getting that knee to 90. The other thing that's important is the strength of this thigh muscle. So straightening your knee and developing good muscle tone in this muscle is critical in helping that leg support you when you step on it. Now for the hip patients, you also need to strengthen these muscles as well, because a lot of these muscles cross the hip, and having those good and strong will make sure your hip is good and stable as well. For hip patients and knee patients, walking is critical. We want you walking at least 100 feet, a minimum of 10 times a day, using, of course, good technique when you do that, so heel-toe gait. When you're ready to go home, or when you need to get in the car when you're at home, the best thing to do is have the person who's picking you up slide the seat back as far as possible. First of all, goes back. Now, the next thing is getting your leg in through this doorpost. Sometimes it's even better if you take the back of the seat and lean it back as well. That gives you the ability to scoot even further up onto the seat. All right, so what we're going to do is we're going to walk up to the car or the truck. All right, now hold on to the car. This is the operated leg. You're going to step up with your good leg onto the frame and slide into the seat. Good. If you have a running board, you can step up with the good leg on the running board and slide back. Now, the hardest part sometimes is lifting the leg to get it in. So using a jump rope or some type of loop around the foot can help you pick up the leg. It also gives you something to help bend the knee with if it's your post-op knee. And as you spin around, you're going to use that jump rope to help lift your leg into the car. Good. Once you're there, then we can bring the seat back up. All right. And to get out, use the loop to help pick up your leg to get out. Scoot to the edge and slowly slide off. Have the walker available. And you're good to go.